Phenobarbital is a general anti-epileptic drug. Yeah. All right. So it suppresses the CNS. I consider it's classified as like an anticonvulsant barbiturate. So it depresses your CNS. So the main thing is avoid abrupt withdrawal because that's really dangerous. It can trigger a seizure because your body is getting accustomed to it. The main thing is use this in the lowest effective dose, and the plasma levels help adjust. So in the textbook, it says 15 to 40 micrograms per milliliter, but it's not very narrow. So it's just more like to help figure out what the lowest effective dose is for that patient. They're administered as oral or IV. So oral would be for your partial seizures and your tonic-clonic seizures, and your IV would be more for that convulsive SE type. It's also important to know because these, I think of barbiturates is like they have, I looked in the textbook and it said how this type of barbiturate is a longer acting one because it's less lipid solubility, which is very interesting. So I think of phenobarbital for bars, behind the bars, you're behind the bars longer. I also try to think about that this is like less associated with the typical barbiturate, which is usually for sedation, and you think of your benzodiazepines, similar to that effect, but this has less sedation effect than other barbiturates. So this is more used for the anticonvulsant effects because of this longer acting. So usually the lipid solubility, it takes slower, and the plateau levels of that therapeutic level, it's going to take about 2 to 3 weeks, which is a long time. So if they need the loading dose to get it started, it's very important for the nurse to make sure they monitor excessively for the CNS depression symptoms. And if they choose to do an IV route, which is more rapid to get into the bloodstream at therapeutic levels, make sure to perform the IV slowly. So those are the main things to know. And lipid solubility, so we know about lipid solubility now, and that's why it takes longer. It's contraindicated for a lot of things to think about. The main things that like pop in my head and I'm starting to think of flash, you know what I mean? So porphyria, patients with porphyria don't take it. So I think of like phenobarbital for the P's of porphyria, your potassium. So potassium hypokalemia, if the patient has hypokalemia, and paradoxical effect in children. So PPP, porphyria, potassium, paradoxical effect. Your paradoxical effect in children, they can get agitation, irritation, instead of having that depressant sometimes. So just remember that could be, and if that happens, you want to call the healthcare provider. Also, this is very important because it also affects your therapeutic effects of your oral contraceptives and your warfarin. But this is really important because it's considered a class D for fetal harm. So if a woman chooses to be pregnant, the benefits outweigh the risks because that mother can have a seizure and it's very dangerous, and they're going to choose to keep that woman, often depending on the physician and their situation, that they would choose to keep the patient on their normal seizure medication. However, there are birth defects risks associated with this. All right, so, and also warfarin. So if this happens, if they choose that they don't want to get pregnant and they are sexually active, make sure that the physician's notified, so maybe they may choose to increase the dosage of their oral contraceptives to be more effective, or their warfarin for their anticoagulants. Also, it's really important because it's already seen as suppressant to not have it with alcohol or other barbiturates. Valproic acid, because they kind of compete with each other, even though sometimes they are used collaboratively, more valproic acid increases phenobarbital in the plasma, basically. So vice versa, how it works. So valproic acid, phenobarbital will be more available. So they have opposite, like they make it more available in the bloodstream. The initial stage, there will be sedation, is expected, but this is not as much as the typical barbiturate, and it's expected for the patient to become tolerant to that effect. Also, the patient should not be younger than 12 years of age to take phenobarbital, and excessively make sure you monitor those level conscious. The patient's potassium levels may drop from this medication, and also their vitamin D, so they may be at risk for osteomalacia or rickets. because of that vitamin C, to make sure they have their adequate calcium, monitor those levels of potassium as well, hypokalemia. So one of the main things is you think of a pregnant mother, administer that mom a month before delivery for potassium, a month before delivery, and also right at delivery. Make sure the baby gets potassium. But actually, all babies are potassium deficient, so all babies really get potassium, as discussed earlier. All right, so other signs of toxicity of CNS depression would be your nystagmus and ataxia. Nystagmus is your eyes can't focus and they keep moving back and forth. Ataxia, your balance. So things are just not right in your CNS system. Some other things to consider from here is, let's say toxicity does happen. I found in the textbook like what is expected to like the physician to do, and they'll do a forced diuresis and alkalinizing the urine. So that's what it says. And stimulants are ineffective and dangerous. This is not on the PowerPoint, but it's not like, oh, you have CNS depression, you're going to add a stimulant to counteract it. That is actually very dangerous. All right, so that is everything to wrap it up. So just remember, it's slower acting. Don't use younger than 12 years old. Your porphyria is contraindicated. Watch for those hypokalemia. Watch for your potassium levels. Paradoxical effect in children. So these are the main things to think about. And minister, if those mothers choose to have a baby, they know their risks, and that if they don't want to have a baby, make sure that they're increasing their oral contraceptive dose, or ask their physician about it. And that if they choose to have a baby, that they have that vitamin K shot a month before delivery and right at delivery. So that is everything to recap phenobarbital.